But what I'd like to do in the few minutes that I have is firstly review the Academy's performance in the past year. And then I'd just like to briefly reflect on the moment in history that we find ourselves in right now. And then finally, I want to share with you what I think are some of the learnings from this pandemic that we should carry forward as we emerge from it. So I'm not talking about what went right and wrong in terms of how we manage the pandemic. I'm talking about lessons that it's highlighted that we need to carry forward. So next slide. To state the obvious, there have been some clouds hovering over us in the past year. So the first of those clouds was Brexit. That's a cloud that's been hanging around for, well, since the start of my presidency, indeed. And I don't know whether clouds can get trumped, but Brexit kind of got trumped by the pandemic at the start of this year. And maybe Trump is a word that we choose not to use. So there have been these clouds, but the positive story I want to tell you is that the Academy has made huge progress despite those clouds. Next slide. So just to illustrate that briefly, and you've seen the financial performance from Ed, it is quite remarkable the way the Academy has continued to grow. And there's no particular virtue in growing our turnover other than the fact that it illustrates that people want to invest in what we do and continue to do so at increasing levels. So the Academy is on a growth trajectory. In terms of our policy influence, I'm pleased to tell you that that also has been going well. So Simon, just before the meeting, was highlighting the winter report, which the government chief scientist invited us to produce a paper thinking about how we should prepare for the winter that we are now in. And this is one of my favorite moments where you see Keir Starmer, the leader of the opposition, waving the Academy report across the floor of the House, asking the Prime Minister if he had read this document. And I only leave you to guess what the answer might have been. But that document has been very well received and has been circulated to all government departments and continues, I think, to reverberate.
You can talk. You don't have
The
to.
policy work that we did at the start of the year and from the end of the previous year was something that I led on trying to optimize the interface between NHS and academia, which I think all of you would agree is hugely important. And this caption here just shows how this was picked up by the BBC. And this, as I say, we completed this just before the pandemic struck. Now there's a series of recommendations. If we go on to the next slide, there's a series of recommendations in this report, some of which are very much directed at NHS organisations, but an equal number of which are directed at the university sector and some at postgraduate deans and so on. I think all 6 of the recommendations are really important, and we will return to the implementation of those recommendations as soon as the COVID pandemic subsides sufficiently to allow people headspace to consider how to implement these things, because this set of recommendations, I would argue, is even more important than it was before the pandemic struck. Next slide. As well as all of that, we've continued to put a lot of energy into supporting careers, as our financial spend illustrates. So we've had another cohort going through the SUSTAIN programme to strengthen women's leadership in science. The FLYER programme, this cross-sectoral leadership programme, the second cohort is running. Extremely important programme in my view. The AMS professorship scheme, we've run that as well. And the Wellcome Trust invited us to put in a multi-year application for funding. And that, I'm pleased to tell you, we heard quite recently was successful. So that's a grant of 15 million over the next few years to support the work that we do with the Wellcome Trust. Public engagement, Nick Hillier continues to lead that extremely effectively. And this comic, DVOC 91, if you're clever, you'll see that that's COVID-19 backwards, has been produced with a group of young people who are really engaged in trying to help young people understand what this pandemic's about, what vaccines are about, and so on. International work also has continued, and not surprisingly, we've put a lot of energy into our European Academy partners through FEAM, the Federation of European Academies, and they're very supportive, of course, of maintaining strong links with us, and we wait to see quite how the Brexit process will emerge in terms of our association with Horizon Europe. Also, a lot of support to low and middle-income countries in the context of the pandemic, holding workshops and supporting their activities. Next slide. So that's how the Academy's done, and you'll hear more about that from the speakers who follow me in much more detail. But just reflecting on this as a moment in history, what strikes me is that I can't remember a time when the opportunities in the field of biomedical and health research have been so great. And those, however, are balanced by some really serious threats. So it's a very stark equation between opportunity and threat. So in the opportunity, in the credit side of this equation, I would highlight three things. The first is that I think we are able now to commit ourselves to developing curative therapies. Now, medicine, as you know, cures remarkably little. So we do cure some infectious diseases with antibiotics. We cure an occasional cancer. But in general, we're pleased if we arrest disease processes or help people live with their long-term condition. I think we're moving to a phase now where we can really up our game and aim to cure more. And the three fields of science that I think offer that potential are gene therapy and gene editing, particularly for single gene disorders, but maybe not only. The second is some developments in regenerative medicine, which don't involve injecting stem cells. They involve persuading tissues, endogenous tissues, to repair themselves. And if that becomes possible, then that will really address a number of serious chronic diseases. And the third is our ability to manipulate the immune system, which has had a big impact already, particularly in oncology. But I think if we continue down this path, I think we can contemplate curing more cancer. I think we can contemplate turning off autoimmune disease processes. And in my own field, I think we can contemplate transplant recipients becoming immunologically tolerant to their organs. So that's the first big opportunity. The second is personalized prevention, smarter prevention, stratifying risk, targeting interventions to those who are most going to benefit, and using technology indeed to reinforce healthy choices. I think that's going to be a very fertile field. And the third is the deployment of emerging digital technologies coupled with AI sometimes to transform our model of healthcare delivery. I think this is very necessary, but I think the opportunity absolutely does exist. And I'm currently leading a piece of work on behalf of the Council for Science and Technology, which will culminate in a letter to the Prime Minister on exactly this topic and how this might be the moment as our healthcare system resets itself post-pandemic to start doing some things really quite differently. Next slide. Those opportunities are really exciting, but they are balanced by some real threats or challenges. And the first is obviously the economic downturn that we know is coming as a consequence of the levels of borrowing that have been necessary during the pandemic. Intense stresses on the NHS. The NHS was stressed before the pandemic, but even more so now. And of course, a stressed NHS finds it difficult to be the kind of research partner that we need it to be. And then Brexit. It's going to stress our relationships and collaborations with our European partners. And it risks, of course, making us less attractive to international talent. And so we need to work collectively really hard to mitigate those risks. I think we can, but what it leads me to conclude is that the Academy has never been more important in managing to help us as a nation seize the opportunities on the previous slide, and no doubt others, and mitigate the risks that might stand in their way. So I think the Academy is ideally placed to have a big impact. The next slide, the last two slides, are my suggestions as to what we might wish to learn from the pandemic and carry forward. And I should emphasize that the 6 things I'm going to mention very briefly, they're nothing new here. These are things that we knew before the pandemic, but I think the pandemic has simply exaggerated their importance. So next, the first of those is the importance of the One Health agenda. Now, often when people talk about One Health, they're talking particularly about the interface between animal species and humans and the health of both. That is one dimension. I think there's another dimension, which is the connectedness of the human population across the planet. We are deeply connected, and this pandemic has illustrated that very clearly. And there's no place for national self-interest when we think about vaccination. It matters to all of us that the globe is vaccinated. So whether it's human to human, animal to human, and I think there we need much more vigilance over the transmission of pathogens from animal species to humans. I'm sure it's happening a great deal more than we are currently aware of, and I think we need to monitor that much more closely. And then the third dimension of One Health, I would suggest, is our interaction with the environment and the climate challenge and all that goes with that. So I think that this One Health agenda is something we would do well to pay more attention to. Next. Second learning for me is just how valuable, and not valuable, essential, is collaboration. It's been so gratifying to see the way that collaboration has benefited our response to this pandemic. This is collaboration between academic groups within the UK, international collaborations and collaborations with industry, and indeed with the NHS. If you look at the recovery trial, for example, that was a huge UK success across the NHS academic interface. So I think, again, particularly in the context of Brexit, we need to put extra energy into supporting collaborative relationships, because it is those collaborations that lead to the biggest impact in terms of meeting scientific challenges. Next. Third lesson for me is that this pandemic has exposed some gaps in our knowledge. And one very obvious one, to my mind anyhow, speaking as an immunologist, is the link between age and severe disease. Of course, it's very interesting. This contrasts markedly with the so-called Spanish flu in 1918, when it was young people that died. I don't think we fully understand why age is such a major risk factor in this particular viral infection. Yes, we know something about immune senescence, but I don't think we know nearly enough. So that's just one example. Another example is ethnicity and risk and different manifestations of disease. So I think there's some things that this virus again has highlighted that we would do well to pay attention to in terms of research priorities. Next. And again. My fourth learning is that the scandal of health inequality needs to be addressed in new ways. So it was true before the pandemic. If you were born in Hull, your life expectancy was 10 years lower than if you were born in Hampshire. That is a national embarrassment. It's indefensible in this day and age. And if this virus has done one thing, it has been to exaggerate inequality. And I think that we need to bring some fresh thinking to what we can do, what actions we can take to address that. We're all familiar with the social determinants of health narrative, which is a very important narrative and based on truth. But I think we should focus our attention now on what we can do, because it'll take some generations before we can close the socioeconomic divide fully. But what can we do to address health inequality? Next. My fifth learning is population health has never been more important. And again, I say the pandemic has highlighted that because, of course, the other big risk factor was obesity. And I think we've seen disinvestment in public health over recent years in the UK. It's not been rich in research as a discipline. And it's great that our next president, Anne Johnson, couldn't be anybody better to help us to address that nationally and make sure that we have a really vigorous population health system in place, imbued with research and evidence. And my final learning is that we do need to create a more resilient health and care system. I talked about that a moment ago. this pandemic has exposed the lack of resilience of our healthcare system. Yes, we coped, but that was only by displacing routine activity for several months, which of course is coming back to bite us now. The NHS often boasts at having 95% bed occupancy. I would say that's not a virtue, it's a risk. And so I think we do, as I was saying earlier, need to bring some fresh thinking to how we can create a health and care system that is resilient, so that it can weather knocks such as this, resilient so that it has some headroom and capacity to engage in research, and that it is generally more sustainable and efficient and productive. So that's my reflections over. I think, as I said earlier, the Academy is in a really, really strong place and has an enormously important role to play in advancing over the next few years as we address those challenges and opportunities. And with that, I'll hand on to our Executive Director, Simon.
Thank you very much indeed, Robert, and good afternoon, everybody. So this is my opportunity to welcome fellows, but also those grant awardees who have been able to join us today, as well as partner organisations and, of course, our members of staff. In a minute, as Robert has said, you'll hear some short presentations on specific projects and activities we've undertaken during the COVID-19 pandemic. But it's my job to try and give you some overview and sense of how we have responded as an organisation. It would be my observation that those organisations that have a good sense of their values have responded best to the challenges and opportunities that have confronted them during the pandemic. Our values of collaboration, striving for excellence, integrity, evidence-based, and also a commitment to being inclusive have really come to the fore over the last 9 months. But I think we've also, hopefully, as you'll see in the coming slides, exhibited really strong behaviours, agility, kindness, and resilience. And it's these values and behaviours that I'd like to focus on over the next 5 to 10 minutes. I'm going to begin my story on Thursday, the 19th of March at 5:45. This is the headline in the Evening Standard that day. This was my last day in the office. Our staff were working at home by then. I was travelling on my way home to Kent. But more significantly, earlier in the day, we had held our last major event in the offices. And that event was a briefing for science journalists hosted by the Science Media Centre, a very important partner of ours, with the Chief Medical Officer, Chris Whitty, and also the Chief Scientist, Patrick Vallance. And I thought it would be good to start the story there, because one of the key features of our response to the pandemic is that we have been very much in the eye of the storm when it comes to the media coverage and interest in COVID-19. And I hope that when you look at this slide, by any measure, you would regard us as having been successful in not just responding to that media interest, but also proactively making sure that good science gets out there for the public's consumption. From being on the Radio 4 Today programme more than 12 times, to having extensive coverage across news channels during some intense periods, as well as hundreds of thousands of downloads of our winter reports and other reports and statements that we've produced during that time. I think one of the really critical drivers of that success has been we are blessed with brilliant communicators. Our President Robert is, of course, one of those, as is our President-elect Anne. But actually, we have many brilliant science communicators across our fellowship and also across our community of early career researchers. And this is the point where I really have to thank them for stepping up to the plate at all times of day and night to help us to respond to the really quite intense media interest during the course of the pandemic. But it's enabled us to fulfill a vital charitable purpose that we have in our objectives, which I think is very nicely encapsulated here in this quote from Fiona Fox, who is an honorary fellow and also director of the Science Media Centre. It has enabled us to put good science and good expertise out into the public domain so they can make sense, better sense of what's happening around them at an extraordinarily turbulent time. What has also, I think, been really impressive and I'm very proud of our organisation about is that we've provided clarity and integrity at a very crucial time when we are faced with an infodemic of often poor information. I think that's often founded on our independence, on the fact that we have an authoritative voice, but I also think it comes down to really careful handling and relationship building. And I would like to pay tribute at this moment to our media and communications team for their extraordinary levels of professionalism throughout all this period. We have responded to requests for media comments with professionalism and with being polite. We've been quick off the mark, but we've also done the right thing by science. And I think that's been incredibly important. And I hope that fills you as a fellowship with a good deal of confidence. That professionalism extends across the organisation. And another area that's, I think, experienced really incredible change over the pandemic has been our policy team. In the past, whereas they might have spent or been able to spend 12 to 18 months producing policy reports, we've now had to turn those around into 6 to 8 weeks. What I think's been really amazing is that we've done that, but we have not lost anything in terms of the quality of those reports, in terms of the content, the evidence on which they're based, or the discussion. And I think one of the critical reasons why that's the case is that the policy team have taken an extraordinarily inclusive approach to producing their reports. So the breadth of expertise, as you can see on that slide, but also involving early career researchers to get their view, but also the inclusion of other voices, particularly patients, carers, and the public. And there we've been able to partner with many of our colleagues in the charity sector, MQ mental health research being a very important one in regard to our mental health research report at the very beginning of the pandemic. We, of course, like many organisations, have had to learn to work virtually, and we have had to make that learning very quickly. And you can see across all our business as usual, but also our COVID-19 activities, we're now doing things online and on digital platforms like Zoom and Teams. I think it's worth bearing in mind, though, however, how quickly we had to transition to this way of working way back in March, with some of these events having to be changed to a face-to-face, in-person event, to a virtual event within weeks or even days. And I think the team have done that brilliantly. And I think what's been very pleasing is that we've again maintained the quality of the work, but also we are now being frequently asked by other organisations just how we've approached them, because we've established a reputation for doing it so well. So my congratulations to the team and being fast adopters of virtual technology. It's also provided us with interesting opportunities about extending our reach. And a good example of this is our International Health Lecture. So in 2019, when we had our International Lecture on Corruption in Medicine with Professor Garcia from Brazil, we had 150 people join us in London with a live link to Brazil. But this year, doing it virtually, we managed to reach 400 people across 66 countries. And so there are real benefits, I think, we're taking from virtual working, which I hope we can carry into the new world or the new normal, as people tend to like to call it at the moment. This, I think, is a very interesting slide. This shows users of our website by time of day. On the left-hand side, that shows the period of July to October 2019. And on the right-hand side, you can see the same period for 2020. So in 2019, people are using our website at pretty standard times of day. So Monday to Friday, 8 to early evening, as you can see it. But during the pandemic, you can see by the increasingly dark shades of blue extending into the weekend and into late evening and early morning, that people are experiencing extraordinary pressures across our community to meet the demands on them that are being posed by the pandemic. And we've had to really think about that and respond carefully and with innovation. You will learn much more about these two projects later this afternoon, the COVID-19 Career Support Space, and also our Pillar Festival events last year to support researchers. I think it's worth bearing in mind, not just what we've done, but actually the dilemma we were faced. So this year, as in past, we would normally hold a winter scientific meeting. And we had to abandon that, obviously, because of all the lockdown restrictions, rather than just leave a gaping hole in our calendar and also leave people unsupported at this time. Our Grants and Careers programme showed their usual talent for leadership and delivery by establishing the Pillar Week event that was held last week, and did so fabulously with a great deal of interest in it amongst early career researchers. So extraordinarily well done to them. And the great thing has been that the feedback on these activities has been marvellous. Not just, again, about demonstrating how good we are at using the new technology, but also that we've maintained the quality of our content and our delivery and the quality of the speakers we're involving. Again, we're also being very inclusive. So I think the constant good feedback that we are getting is really helpful. And I would like to just thank people who do that. All the feedback we have, we listen to and look at very carefully to see how we can strengthen and improve what we do. I started off with these as our values. What I didn't tell you was these are the values that the staff define during the course of 2 away days in the summer. And I think they've exhibited those values splendidly over the last 6 months. It's worth bearing in mind, though, that that extends to our back office. Our finance department, for instance, has produced electronic audited accounts for the first time this year, but despite the restrictions. And our facilities team have constantly gone into the office to make sure that the building is fit for purpose for the moment that we can go in. And I think that's been very courageous of them during very intense periods of lockdown when people were not using public transport. So I'd like to take this opportunity to thank them for that. 2 very last slides, and then I will hand over to our next speaker. So staff health and well-being is, I think, as for many chief execs at this time, something that makes me lie awake at night. But again, our staff have shown real leadership and proactivity here to ensure that we take care of one another, but also take care of those who come to us. We have a brilliant wellbeing staff group. We are supported by an excellent, if a small HR team in Germany and Maxi. We've provided people with resources. We are trying to work agilely. We've ensured that people have the equipment they need to work from home, but we've also had some fun with things like quizzes. And you can see that on the right-hand side, I'm not very good at the staff quiz many times. So on that note, I would just like to finish by, first of all, thanking Robert for his immense support throughout the year. I'm sorry it's his last year, my first year, but very finally, I wanted to just pay tribute to the staff. These are all our staff. And I hope that when you end and give us all a round of applause at the end of this session, some of that applause will be this amazing team that I work with every day. Many thanks to them, and thank you for their achievements.
Simon, thank you very much indeed. And could I just take this opportunity to say what a great job Simon has done. I mean, can you imagine this being your first year in post for a new organisation? He's handled it brilliantly, and I want to really pay credit for that. So with that, we're going to hand on to another esteemed colleague, Rachel Quinn, who's the Head of Medical Science Policy.
Thank you very much.
Rachel, before you start, we are a little bit over time, so I'm sure you'll be disciplined.
Thank you, Robert. You and Simon have stolen all my best lines, so I should be able to go a bit quicker. So, as always, the Fellowship has been at the centre of our COVID policy work. Fellows have led and contributed to expert advisory groups or been speakers at workshops. Our priorities have been determined by our fellows through the officers and council members, by contributors to the All Fellows COVID-19 meeting in July, by our regional champions, and most recently by our fellows. Our new Fellows COVID-19 Advisory Group. So influential policy projects really require the combined efforts of expert policy and communication staff, which I'm very pleased to say we have. But without the fellows, other experts and partner organisations from across the world who have worked with us and met our unreasonable timelines, we wouldn't have been able to ensure that decision makers, the media and the public had access to independent and rigorous scientific advice and information. So I wanted to start by saying thank you from all of us. Next slide, please, Simon. So firstly, I wanted to talk a little bit about our policy activities and projects where the Academy provided recommendations for action to decision makers. So we convened 3 expert working groups in rapid succession. Our normal working group model, as you've heard, of 12 to 18 months was not appropriate and was replaced by a 6 to 8 week version. You'll hear later how, despite these very short timelines, patient carers and people with lived experience generously shared their perspectives. Firstly, recognising that neuroscience and mental health was at risk of being overlooked at the start of the pandemic, we worked in partnership with MQ to develop a consensus on mental health and neuroscience research priorities, which was published in The Lancet in April. We've really continued to promote the importance of these priorities and facilitated the development of consortia funding bids that brought together experts from across these disciplines. And we just agreed at Council we will follow this up a year on from that work. Again, in partnership, which has been really important, we worked with the British Society for Immunology to identify knowledge gaps for SAGE in June and identified research priorities needed to fill these gaps, and a successful consortia funding bid emerged from this project. So these first 2 projects were proactive, addressing gaps that we, in particular Robert, had identified where no one else seemed to be focusing. But in early summer, as you've heard, we responded to requests from Patrick Vallance to characterise a challenging winter and identify priority actions. So the interdisciplinary expert group was informed by a group of 8 patient and carer representatives, and more of that later from Nick and Mandy, but particularly supported by 14 amazing early to mid-career researchers who supported the staff, and we couldn't have developed the report without them. The report was published in July, containing a series of actions. As you've already heard, it was sent to the government's by the government's chief scientific advisor to all perm secs. It was promoted in Parliament by the Leader of the Opposition, presented to the Welsh Government, and is still receiving considerable media attention. Time will tell its overall impact, but we've had anecdotal evidence that it has been influential, so worth the hard work. And finally, last month, we published a statement highlighting the changes required to improve diagnostic testing, including the importance of closer partnerships with academia, industry and the NHS. And we want to address this next year in a wider context. Next slide, please, Simon. So one of the Academy's great strengths is its ability to bring together experts and decision makers. And the benefits of those events are both the discussions that take place normally in the room, but in this case on Zoom, and then the published synthesis of these discussions. 2 examples of this were the forum workshop in May on patient and public involvement in life science research, which was in fact in place before the pandemic, but we pivoted it to examine this topic through a COVID lens and highlighted the decline in patient engagement during the pandemic. And then the workshop in July that supported funders, charities and researchers to look beyond the short-term challenges to research careers and to focus on some of the medium and long-term challenges and opportunities. A slightly different example of the Academy's convening power is the development of the COVID-19 preclinical drug development database, which aims to identify gaps in the drug pipeline and promote collaboration. If there has been a benefit or a silver lining to the transition to online meetings, it's been our ability to facilitate access to international experts on our working groups, collaborations with our international partners, and our ability to engage an international audience. Whether it was the meeting with our colleagues at the Brazilian National Academy of Medicine in April to share learnings from tackling COVID-19 back in the early stages of the pandemic, or our international health lecture, which you have already heard about, engaged 400 people from across 66 countries. Our international activities have grown considerably under our outgoing president, with the support, of course, of our incoming president in her role as VP International. It's therefore really appropriate to highlight one of the most impressive policy events that we've been part of this year, the workshop in June on the response to the COVID-19 pandemic in collaboration with 8 academies and organisations from low and middle income countries. I'm really grateful to Professor Guy Thwaites, who chaired that event and who has, I hoped, joined us from Vietnam to tell us more about it. I'll hand over to Guy. Thank you.
Yes, I'm here. I hope you can hear me. Yes, joining from Ho Chi Minh City in Vietnam, rather later in the day than with you at the moment. But thank you. I'm going to tell you briefly about this very, very excellent workshop that was organised very rapidly and very efficiently by the Academy staff. I think it was the first of the virtual international meetings, and therefore there was a little bit of nervousness before we started as to whether it would work well, but it worked phenomenally well. So I'm just going to tell you a little bit about it. So you can have the next slide, please. So the aim of the meeting was to bring together experts in in an array of important disciplines relevant to the COVID epidemic, but particularly the clinical, the social and public health components. And it did so across 8 countries, also including representatives from the UK and the USA. And this was relatively early on in the pandemic, and it produced some very, very fascinating discussions and conclusions. There was encouragement to share experiences, both positive and negative, between countries, to identify the key unanswered questions that existed at the time, and many still exist, and explore how science particularly, but also the use of evidence, has been used to guide the pandemic response. Next slide, please. So you can see here the range of countries that were involved in this meeting. Very, very varied experiences at the time. You will note that some countries on this highlighted here have had and continue to have a pretty bad time with the epidemic, but some low middle income countries particularly have done rather well, so Vietnam particularly. So we are just getting rather anxious about our first community case for the last 90 days, the first one that's happened. Anyway, the representation was fantastic. The conversations were enthralling. And next slide, please. And the conclusions were very well articulated in a report, which you can see there, and I'm sure is easily available from the website. But there were 3 main conclusions, and some of these have been mentioned before, particularly by Robert in his talk. But there are 3 things that were thought to be particularly important. The first was international and interdisciplinary collaboration, and particularly the importance of social and behavioural sciences was discussed. The second was the need and the evidence of innovation and adaptation, not always around new technology, but obviously that has been important, but particularly around the development of drugs, innovative approaches to clinical trials, for example. And finally, and this was very much borne out from the discussions, was the importance of leadership and trust, particularly trust of governments in public health messaging. And clearly amongst the countries that we had representing at this meeting, there was very, very wide differences in the quality of leadership that was being exhibited, and that was having tremendous impact on how the pandemic was affecting people. So it was an excellent meeting, and I very much hope that perhaps in early 2021, and we'll be able to meet and do something like this again, perhaps with respect to looking at how vaccines might be changing the experience across the countries. But thank you very much for organising the meeting. It was a pleasure to be a part of.
Okay, on to Virginia Newcombe to share with us some reflections on career support.
Hi, so thank you very much for having me today. It's a great honour to be here on behalf of all of the people who've worked very hard on the COVID career support space over the past few months. So I've been asked to talk about the space, both in the context of someone who's helped develop it, but also as a user of it. And so I thought I'd give a little bit of a background of how I came to be involved in the space. Next slide, please. Over the past few years, as an early career researcher, I've really benefited from having some involvement with the Academy of Medical Sciences that's really helping to form my career. And one of the big things I've been involved with was Sustain. And so these are all the wonderful women who are part of my cohort of Sustain, the second cohort. We've actually been in contact with each other over the year, supporting each other through this pandemic. Next slide, please. I've also had the great privilege of being a Clinician Scientist Fellow. And this picture was taken on the last day I was actually in London this year, on the 3rd of March, when we had an awardee meeting. At the time, I don't think any of us realised what was about to happen. We all knew about COVID. We were talking a little bit about COVID and so on, but none of us knew that on the 23rd of March, all of our lives would change. And indeed, the whole world has just changed remarkably over this period. Next slide, please. So by way of background, I'm an emergency physician and an intensive care physician. And this is a picture of me in PPE and some of my wonderful colleagues in the neurocritical care unit that I usually work in that turned into a COVID unit earlier in the year. So there was a saying that really resonated with me early in the pandemic, and that was that the only certainty is uncertainty. And it was certainly true. There were so many things going on. So we didn't know how to treat these patients properly, and every day our protocols were changing. There was rapidly changing how the hospital was configured. And it was just a very uncertain period. And so, sorry, excuse me. Susie Candy reached out to me very early on in the pandemic and asked me, how things were going and what things could be done to help. And so I had a long conversation with Susie, and I think conversations that I had and other early career researchers and many other people had all formed into the idea of creating a career support space, as there was a clear unmet need of what was going to happen to people who were academics, who were suddenly being pulled to the front line, or suddenly had their whole research careers suddenly stopped by virtue of the pandemic. Next slide. So one of the first things that was done was that there was a workshop performed in July. And it had many different people involved. And we came up with a few sort of key points that we thought were important to be mindful of. I'm just going to highlight a couple of them here. So the first was that the COVID crisis really affects people in different ways. And so there are a lot of people who are doing some fantastic research. So we've already heard mention of the recovery trial and so on in the UK. But for others, their entire academic careers have stopped this year. And so we felt it's important to have this crisis memory embedded in future funding calls so that people don't forget that some people really struggled this year. And other points that were important were to have clear communication, as well as to prioritise support for those who are most affected. And I think probably the most important point of all is that at the bottom, which is to be how to inspire and to support future talent so that this country and indeed the world doesn't lose an entire generation of future academics because of the COVID crisis. Next slide, please. So knowing that there was all these gaps in the system and that people were really searching for answers and searching for support, the idea was came up to have a website or a support space where people could go and get a whole lot of information. So I would really recommend that anyone who hasn't looked at this web page to go and have a look at it, as it really does have a lot of information there and it sort of has something for everybody. Next slide. So you can see that there are many different topics. So these were the key things that we felt would be important to people during the crisis, ranging from challenging inequalities to looking after yourself, how to cope with the isolation of being in lockdown, and how to deal with stress and overwork as examples. Next slide. So each page is structured so that it starts off with a personal story. So a researcher or other is talking about things that are pertinent to that page. So this example here is Dr. Kamara, who gives an excellent talk about how she dealt with the Ebola epidemic that she was involved with and gives some really good strategies to use in COVID. Next slide, please. I should also say that those websites also have, the next tab on them also have resources. And those resources are a really valuable resource and they link in with the flyer program. So Cirrus has very kindly enabled all of those resources to be there. And then there are also links to other organisations that have been highly curated to be really useful and important links. The Academy's also done a whole lot of events in order to help people through this year, and they sort of feed into the support space. So for example, the one in November of Where to Draw the Line was a very popular event that was really useful. And in order to highlight all of these things, a lot of social media work has been done. And so these examples to the right of the slide are just some of the tweets that have come out from the Academy to make sure that those people who would most benefit from looking at this space are aware of it so that they can look at it. Next slide, please. And it certainly has had an impact. So this is just some of the statistics from earlier in the year of people looking at the website. And you can see that in June, when we were probably at that peak of the pandemic, there were a lot of hits on the website. and I suspect that now we've gone through another lockdown, that the statistics will be, or the number of hits will be even higher. And not surprisingly, it's the stress and overwork page that has got the most hits. And I think that truly is reflective of just how stressful and bizarre this year has been for pretty much everyone. Next slide, please. And so I now just wanted to touch on what we were thinking about for the future. So the one thing that is clear about COVID is that it has exacerbated every single inequality possible that is present in the system. And so we really want to concentrate on trying to stop people falling between those cracks. And this includes focusing on equality and diversity, focusing on non-clinical academics. So in some ways, they've been more affected than clinical academics because labs have shut down, animals have had to be euthanized. And so they're a really important group to reach out to and ensure that they don't get lost to academia. It's also been a difficult year for particularly early career researchers who are trying to lead teams for the first time, who haven't yet got their leadership skills, and they're trying to learn all of this virtually. And also how to juggle all the responsibilities as we get used to that and use that now what is becoming a phrase used everywhere, the new normal. And I put up there that it's time limited, this future that we've got, because we're hoping as a group that as we have the vaccines and as hopefully the pandemic resides, that a lot of the work that we're doing will no longer need to be directed just at COVID, and we'll be able to evolve and morph into something that's a bit more general. And I just wanted to end on a positive note and say that it's not been all bad. There are a lot of positives that have come out of the pandemic in this space, which includes knowledge that we can move faster as a system and can instigate change as a system very successfully, that we can collaborate and work together very successfully, and that there are a lot of advantages to the virtual world. And so some of this space is to try and take advantage of all of those things as well as help people cope. Next slide, please. And so I just wanted to finish by thanking all of the people who've been involved in developing this space. In particular, Paul Stewart, who's done a fantastic job of chairing and directing the committee and sort of honing down our ideas into workable ideas. And I'd especially like to thank all of the Academy of Medical Sciences staff who've really worked hard, and they've worked very fast. With all of the things that were going on early in the pandemic, it was amazing to see how quickly the page came into being and became a really useful page and well-used page very, very quickly. And so I'd like to say a huge thank you to all of them.
Thanks very much, Virginia, for sharing all of that. Such an important issue that we do everything we can to support people at this vulnerable stage in their career. So moving on briskly, so we're next dealing with patient and public engagement and handing over to Nick.
Thanks, Robert. So for me, one of the most important things that we did right at the start of lockdown was to make a commitment to do all we can to include public and patient views in our work. And the pandemic has certainly tested that commitment, but I hope after hearing about 4 of the projects I'm going to talk to you that we've worked on, that you'll agree we've held that true. The first project has been highlighted by Rachel, and that's a project that we did to identify a research roadmap to keep us all mentally healthy through the pandemic and beyond, a topic very high on the public agenda. We worked to ensure that the thinking of this expert group and their publication in the Lancet Psychiatry was underpinned by and incorporated the views of public service users and their carers. This included an Ipsos Mori poll with 1,099 members of the UK public, and a survey of 2,198 people with experience of mental health conditions, either themselves or as a carer for someone living with a mental health condition. We also had 3 representatives with lived experience who provided input as part of the expert group, not just participating in the discussions, but co-authoring the publication and a forward to the survey reports when they were published. Simon, sorry, can I just jump 2 slides? I missed my first one. So the second is our winter scenarios report. The deliberations of this expert group were informed by a group of 8 patients and carers, and the 2 co-chairs of this group sat on the main expert group. It's fantastic to be joined by Mandy Rudczenko, who is a co-chair of our patient and carer reference group, to hear her views on the work today. In addition to the patients and carers on the formal groups, we work with Ipsos Mori again to run workshops with members of the public, with individuals who'd received shielding letters or who were caring for people who'd received letters, and with individuals from Black, Asian and minority ethnic groups to understand their views and priorities for the UK in coping with then a possible, although we now know actual, resurgence of COVID-19 over the winter. Lastly, on this project, we work with our patient and carer reference group to develop a people's perspective report that went to Sage alongside our main report to highlight the key messages from all of that engagement work. Next slide, please, Simon. The third project is one that has grown throughout the pandemic and one established in partnership with Wowbagger Productions and Vocal, the public programmes team at Manchester University. It was initially set up as a way of enabling young people aged 16 to 24 in the UK to explore the pandemic, but it's expanded to an international conversation with groups of young adults in India and South Africa, and drawing in support from the WHO and Wellcome. Planet Devok 91 is a 9-part comic written and drawn by some of the leading names in the comics industry. Its launch was covered in The Hollywood Reporter, who flagged it as one of the most entertaining and creative responses to the coronavirus outbreak. Next slide, please, Simon. The story for each issue is developed by a group of young adults following interviews with leading scientists drawn from the Academy Fellowship and our grant awardees. Each chapter includes bonus articles written by the young adults on the issues most important to them, including misinformation, inequality and stigma, and mental health. We're working with the groups to build skills and create opportunities for them to use this experience to affect change in the areas that most matter to them. So please do take a look at the 5 issues that are live now and follow the story of Sander and Champo and the characters they meet along the way as they try to understand the impact of a new pandemic that has hit Planet Devok. I have to say this has been an incredibly rewarding project for the Academy to work on and has given young people a voice and connection to medical science that they've never experienced before. I'd like to share some words from Alma, who's one of the adults in the UK group, that sum up what a difference the project has made to her. She says, as a young adult, I've never had the chance to voice my opinion before. This project has taught me to have confidence in those opinions and my ideas and has given me the chance to discuss them with high status figures. I've got the opportunity to do something that I love, to develop something that could help others in the pandemic. It's given me motivation when I had none, hope when I was running out. I'm not exaggerating when I say this project has been one of the main reasons why the lockdown was bearable for me. The next slide, please, Simon. The last project, Life Support, is one that was developed to replace the many face-to-face events that we were planning to run across the country as a continuation of our Departure Lounge project. With daily reminders of the numbers of people dying after COVID infection, there was no doubt that the pandemic had made conversations about death and dying even more important. However, we felt that the playful tone of the Departure Lounge that worked so well to encourage conversations before the pandemic didn't quite fit. So again, we connected with our partners, the Liminal Space, to translate all of the content from the Departure Lounge into a virtual resource to take those conversations online. Additional content has also been developed to help answer some of the questions people had about dying with COVID, but ultimately to support them to share their wishes and understand those of their loved ones so that they can be as prepared as possible for whenever the time comes. Looking ahead to next year, we'll be working to bring those public, patients and carers from all of these projects back together again to explore the continuing impact of COVID on our lives under the banner of PAGE, our People's Advisory Group on Emergencies. So there are 3 things that I think have characterised our public and patient work this year. Firstly, it's speed. It's been mentioned that the pandemic has meant we had to shift from timescales of months or years to a matter of weeks. Although those timescales are not ideal for planning projects, we made a conscious decision to do what we could in the time we had and not use a lack of time as a reason not to include engagement in our work. Secondly, space. Like everyone, we had to adapt to engaging in different spaces. The shift to online engagement at speed was challenging, but our approach was to learn as we went, building spaces with the people we wanted to engage rather than waiting to find the perfect solution. And lastly, status. Throughout this pandemic, nobody has specifically asked us to include public and patient engagement in our advice, but we don't wait to be asked. We do it because it adds value and a better understanding for those who seek our advice. By giving public and patient views status in our own work, we demonstrate the importance of others, including a greater diversity of voice in theirs. So I'll hand over to Mandy now, one of those voices, to give you some reflections on her participation in our winter scenario project. Mandy.
Thank you, Nick. So I'm a carer for my son who has cystic fibrosis, and he was in shielding during the first lockdown. I've been involved in public engagement and co-production for over 5 years. So as co-chair of the Patient and Carer Reference Group for the Winter Project, we had 3 weeks to discuss our concerns and experiences, to feed back to the steering group, to review the report, and to write our own People's Perspective report to accompany the main report. So no pressure. So I have to say, in that short space of time, we achieved more than many co-production projects achieve in a year. And the obvious question is, how did we do that? So from the start, the Academy voiced a strong wish to genuinely involve us as equals from the start. And this aim was backed up by action. So we had open and honest discussions about the actual process of our involvement, which resulted in good teamwork. One key enabler of engagement is to co-produce the process. The Academy made it clear how our input was influencing the report and that our evidence would be clearly woven in and clearly flagged in the report. And our involvement was nurtured. Supporting us to co-produce our report came practically and psychologically. So the Academy believed that we could do it, and so we believed we could do it. They fulfilled their commitment to actually include our report, which I must admit some of us were a bit sceptical about, to be honest, but it went beyond our expectations that our report was actually included. And the Academy also managed to reduce some of the barriers that can get in the way of good engagement. I mean, being asked to become involved in a report for the Academy of Medical Sciences can be quite intimidating. But the staff were very good at reducing the hierarchical and the jargonistic barriers. But one of the most important things that the Academy did was to recognise the vital partnership between scientific evidence and human evidence, and how vital that is to translate research into patient benefit. And both Robert and Simon have highlighted the importance of collaboration already. So that just reiterates that. So I just want to finish by reiterating the value of engagement, the fact that it makes research relevant to people's lives, and that reports written are relevant to people's lives, and that we don't make assumptions about that. So thank you.
Mandy, thanks very much indeed for your engagement, involvement and contribution, which, I mean, I hope you now absolutely appreciate. We genuinely think makes for a better product all round. So last up, research funding implications. A few words from Paul before we take a break. Paul Stewart.
Yeah, thanks very much, Robert. So I'm conscious of time, but I did just want to bring the fellowship up to date on one of our 5 strategic priorities as it relates to developing talent. Next slide. Next slide, please. So you'll see that this is within the current strategic plan, but also aware that we're beginning a new strategy. But I think it's fair to say that the heart of this objective will remain key to the work of the Academy, particularly in supporting tomorrow's researchers at those critical points in their careers. Next slide. One point I wanted to make to you, and I think you're all aware of this, but we do see the Academy is more than just a funder, and we provide holistic support for careers through effectively 3 big platforms: careers policy, for example, our ongoing work on team science, lobbying for building capacity in research careers, as well as the grant scheme and programmatic support and mentoring. So the next slide shows just how impressive the current portfolio is, with funding in this space increasing 5-fold over the last 5 years. It covers a wide breadth of disciplines and career stages, from our undergraduate Inspire programme through to early career researchers, right through to our professors and future leaders. Increasingly, I think we play an important UK four-nation coordinating role, notably in terms of mentorship schemes and alignment of activity, particularly relevant in my space, the Clinical Academic Training Forum. So a few headline statistics from the last year. Firstly, in the next slide, firstly, a big thank you to the Wellcome Trust, who've just awarded the Academy 15.5 million over 5 years, which will help fund this portfolio. And this has helped take our annual spend now on careers to over 10 million per year. You'll see just some of the headlines here, 100 mentor-mentee programs this year, which takes that total to over 1,000. We're in the second cohort of the Immersive Leadership Flyers Scheme, 35 participants, and about another 50 starter grants and Springboard fellowships. The Springboards this year extending to public health. Next slide. So you've heard, I think, about the new initiative this year. Simon's talked in this at detail in terms of this replacing the winter meeting. And a big thanks to Francis Platt for pulling this together. Over 250 fellows engaged on this. I dropped into several sessions, including an inspiring talk by John Iredale at the end of the meeting. But the point we want to make here is that we're building a community, our alumni as we now refer to them, and we have built this kind of family trust here in terms of what is really meant by that wider support to these fellows. Next slide. So we're passionate about going out and providing an evidence base for our schemes, and we've done that formally with the starter grants and Springboard. And that's, of course, endorsed by these personal quotes, be it from starter grants, mentorship, or our flyer programs. Next slide. I think we're very much aware that we, the work we do doesn't take place in a vacuum, and the external environment is impacting on those we're looking after to support. But obviously, with headwinds such as Brexit and COVID that we've talked about extensively, invariably these bring new opportunities, and the Academy continues to work across these key initiatives, some of which you see are outlined in this slide. And this is a huge amount of policy work behind the scenes to make sure we can maximise on these opportunities. I'm going to rush through the next few slides in interests of time, but just briefly, the next slide, you've heard really nicely from Virginia, her personal journey through the COVID resource space and the COVID career group that we've put together. And it was a real pleasure to chair the multi-stakeholder workshop that you see outlined here. As we've seen, next slide, there is an impressive range of material on the COVID support space. Amazingly, we've had over 6,000 website hits on this since its launch. And a particular favourite of mine, which is very popular, Philippa, was your outstanding contribution on stress and overwork. Next slide. So I think looking ahead, the Academy continues to take these findings forward. And one thing I just wanted to raise to all the fellows in the room in terms of all of you in influential positions within your own institution is this fundamental issue of the inbuilt COVID memory here in everything we do. Because this will endorse our commitment to enhance equality, diversity and inclusivity that COVID has really further exposed. So please do be very active in your own daily lives in terms of taking that forward. And as you see here, resources allowing, there's no shortage of exciting plans for what's coming in the future. So just two final slides, just to give two examples of our awardees, both Springboarders and Sustain alumni. The first is Nisreen Alwan, who's just been included in the BBC Top 100 Influential Women list for her international work on COVID-19, mortality, morbidity, including long COVID. And Kate Baker here, who responded very quickly to a call from government and took a secondment to join SAGE. And finally, the biggest thank you of all, and you sense the huge join up there is between the officers, the council, you as fellows, and this amazing team we have behind the scenes, without which this wouldn't have been possible. And particular thanks to Susie Candy and Tom Livermore in this space. We couldn't have done any of this without this engine. So a big thank you.
Thanks very much indeed, Paul. So I hope that those series of talks have really reassured you that the Academy's fully active despite some of these constraints, and we've had a really outstanding year.